So Ruth, this is Breathe Light, and we're going to use some degree of relaxation. It's not going to be perfect. Breathe Light is a very interesting exercise in terms of it's actually having you breathe less air into your lungs to increase the gas carbon dioxide inside in the lungs, which in turn increases carbon dioxide in the blood. And carbon dioxide isn't just a waste gas. It plays a role in bronchodilation, in helping to open up the airways. And there are other aspects, beneficial aspects in terms of this exercise. But in terms of asthma, one of them certainly is focused on carbon dioxide. Another is that we have you induce a sense of relaxation and air hunger. And it's almost to desensitize the body's reaction to the feeling of air hunger, because every time that we have asthma symptoms, we feel that we're not getting enough air. And that can bring on a sensation of panic. It can contribute to anxiety. Here we deliberately induce a sensation of controlled air hunger to desensitize the body's reaction to it. So you could do it, for instance, just sitting up straight, have your head looking directly in front of you, and roll your eyes upwards as if you're looking out through a roof light in the top of your head, and then just gently allow your eyes to close. And bring your attention onto your breath. Focus on the slightly colder air coming into your nose and the slightly warmer air as it leaves your nose. And you could bring a feeling of relaxation to the top of your head. Allow the top of the head to relax. Allow the back of the head to relax. Allow the forehead to relax and the muscles around your eyes to relax. Allow your jaws to relax. Allow your neck to relax. Your left elbow, left wrist, fingers relax. And your right elbow, right wrist and fingers relax. And just bring a feeling of relaxation to the area around your chest, and also a feeling of relaxation to the area of your tummy. Now, in doing this, bring some attention out of your mind onto your breathing. And the whole objective is to gently allow your breathing to soften to the point of air hunger. So there's your breath coming into your body, and there's your breath leaving the body. There's your breath coming in. There's your breath leaving. So with relaxation, gently soften the speed of the air coming into your nose and also the air leaving your nose. So the objective is that you're gently softening the speed of your breathing to the point that you feel a tolerable air hunger. As you breathe in, slow down the speed of the air coming into your nose, and then as you breathe out, have a really relaxed, slow, gentle breath out. So it's not about holding your breath. It's not about deliberately interfering with your breathing muscles. It's just about gently softening the speed of your breathing to the point of air hunger. So the objective is to have about 30% less air coming into your lungs. And as a result, the gas carbon dioxide increases in your lungs and blood. And this generates the feeling of air hunger. But bear in mind that as carbon dioxide increases in your blood, it also helps to open up the airways. So you're taking a very soft and slow, gentle breath coming into your nose, and a relaxed and a slow and a gentle breath out. And you're softening the breathing to the point that you have air hunger, and the feeling of air hunger is tolerable. You're not holding your breath, you're not freezing your breathing, you're not deliberately interfering with your breathing muscles. You're just allowing the breath to go softer. You're slowing down the speed of the air coming into your nose, almost that the breath in is imperceptible. Very soft breath in. And then you're having a really relaxed and a slow, gentle breath out. And then the next breath in, it's a soft breath in, soft breath in. And then a really relaxed and a slow and a gentle breath out. Now, if you have involuntary contractions of the diaphragm, the air hunger has gone a little bit too much, then you take a rest. Or if you're feeling stressed, take a rest. But with practice, you will be able to close your eyes, bring your attention into the body, and gently soften and slow down your breathing to the point of air hunger. And this is a tremendous exercise for asthma. It's a tremendous exercise to help to improve asthma control and also to significantly reduce the need for medication. So by improving asthma control, it can lead to a significant reduction of symptoms such as coughing, wheezing, breathlessness, chest tightness, colds, chest infections. Soft, gentle breath in through your nose. And that really relaxed and a slow and a gentle breath out. So all you're doing is just using relaxation and also encouraging your breathing to soften. There's your breath coming into your nose There's your breath leaving the nose. There's your breath coming into your nose. There's your breath leaving your nose. And now to gently soften it. So the next breath in, gently soft, 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 soft breath in. And then a really relaxed and a slow and a gentle breath out. And then a soft, soft, soft breath in through your nose. And a really relaxed and slow, gentle breath out. Allow your breathing to soften to the point that you feel that you're not getting enough air. But if it feels a bit uncomfortable, just go back to normal breathing. So there's always that kind of fine line. Air hunger, you want to feel relaxed, but you want to have the air hunger. But sometimes it's normal that the air hunger gets a bit too much. So we'll just continue it for the duration of the 4 minutes. Again, soft, gentle breath coming into your nose, and a really relaxed and a slow, 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 slow breath out. And then whenever you're ready again, we're taking a soft, gentle breath coming into your nose, and a really relaxed and a slow, gentle breath out. So using relaxation, and also by focusing on the airflow coming into your nose, you're slowing down the speed of the air coming into your nose, and then you're having a really relaxed and slow, gentle breath out. You're softening and slowing down the speed of your breathing to the point of air hunger. The air hunger should be tolerable, not too much, not too little, just right. And that gets easier with practice. So with this route, you're just gently allowing your breathing to soften. Now, some people like to have their eyes open when they're doing the reduced volume breathing. Some people like to have their eyes closed. So there's 2 approaches, and you can choose then whichever one works for you. So whenever you're ready then, just to gently open your eyes. And that's reduced volume breathing, or the breathe light exercise. It's about using a sensation of relaxation and just focusing on the airflow coming in and out of your nose, and just gently softening the breath to the point of air hunger. Sometimes people feel there's a little bit more to it than that. There's not. I know the whole challenge is air hunger and feeling fairly relaxed at the same time, but it comes with practice. And it's a very nice exercise to do, and it's tremendous for asthma.